Greetings from Aspen, Colorado. My name is Lucia Lee, Vice President of Media and Public Affairs at Mount Sinai Health System. And I'm really honored to be here with Dr. Kenneth Davis, CEO of Mount Sinai Health System. Hi, Dr. Davis.
Good to see you.
Good to see you, too. It's been a great festival thus far.
Yes, it has.
Great. And so it's our 10th year as one of the underwriters here of this Ideas Festival. What does that mean to be here, 10 years here, participating?
Well, we're proud to be a sponsor. This is a special meeting which brings together a unique group of people.
Yeah.
Where else can you get cutting-edge scientists meeting with cutting-edge policymakers, the people who make things happen, as well as a number of really great opinion leaders?
Yeah.
So you put all that together and you discuss science and public policy and health. There's no other meeting in which that happens. And of course it happens in this beautiful environment. Yeah. So it's a pleasure for us to be able to facilitate that through our sponsorship.
Well, if you've been here on the ground at Aspen, you know what Dr. Davis describes, policymakers, thinkers, doers, just discussing and advancing thoughts forward. I mean, this is where things get done, you know? So the goal of us participating here, we have several faculty members here participating in conversations. What's the goal of sharing the ideas?
It's multiple.
Okay.
Some of it is we want to learn from other people. A lot of it is we want to meet other people and develop new relationships. And finally, we want to be able to talk about what's going on and educate people around some cutting-edge issues that are happening in healthcare and in science.
Yeah. And at Mount Sinai, we're pretty cutting edge.
We do a lot of cutting-edge work. As David Petrino, when he was talking about COVID, talked about what we've learned, why there are some people who just don't seem to get better, the long haulers, what we're doing about the long haulers. And I think it was fascinating for a lot of people to hear that. But it was also fascinating for people to hear at the height of that pandemic, when in our hospitals we had over 2,000 COVID patients. How do you cope? What was it like to put a tent in Central Park, to find whatever workers you could to be able to take care of these patients? Now that's information we wanted to share with people so they could understand how serious it was, that we need to have our country prepared for future pandemics like this, and just to listen to their response to what we did and what they think we should do in the future.
Yeah. Mount Sinai's response during the pandemic has been well documented. Lots of innovative ideas came out of that crisis.
Yes.
Yeah.
And now what we're trying to figure out is for the perhaps up to 20% of long haulers, how do you treat them? How do we make them better? What's going to happen to them? Why did it happen?
Yeah. There's
a lot of science that's going on around that.
Yeah. Well, what have been the highlights for you thus far for Aspen Health?
Well, it's funny. I hadn't been here since September 2019.
Yeah.
And one of the highlights was simply arriving and seeing the beauty of Aspen again.
In person.
It's just wonderful. I'm not surprised by what the people say. They're my people, and I'm not, I anticipate what's going to say. But every time I see the aspen leaves floating in the breeze, in the wind, and I see how beautiful that is, that's also innovating to me, and inspiring to me. It's very inspiring.
Look around, this scenery is pretty magical and fantastic. Mount Sinai, we've had a Mount Sinai Health experience here where we've offered full body scans, we've offered skin screenings. It's really important to offer these services for the community here.
Well, always. It inspires me to listen to the response of people who got skin screening in the years past, because sometimes we pick up some very serious skin cancers and we save lives.
Yeah.
And that's inspirational. But this year we have a scan, a body scan. And I listen to people come out of the body scan, talk to our doctors about what they found, and I'm inspired by the enthusiasm of people to get that care and for them to know, we're not taking any money from them. I mean, when this is over, there are no bills.
Yeah.
And I think they're so accustomed to the notion that there is a transaction that includes a monetary component, that when you're providing health care, just because you want to do it and you feel it makes you happy because that's why you entered this field,
Yeah.
that I think it inspires a lot of our people, it inspires me, and it gives a lot of just good feelings about what Mount Sinai stands for, what this meeting is about, and how we can all come together to improve people's health.
Wow, that's an important message. That's really lovely. So Mount Sinai has a powerful lineup. We've had a powerful lineup here. You talked about long COVID. We've had conversations on psychedelics as well.
Yes.
It's been really, really delightful. And what would you say? Like, what are the big ideas from our Mount Sinai team that folks should walk away with here at Aspen?
We're going to be talking a lot about value-based purchasing.
Mm-hmm.
We're going to be talking about other ways that we can make healthcare affordable. How do we go from a system in which you get paid every time you do something, which encourages you to do things, to a system in which you get encouraged to keep people well? And that will be happening in the next few days in some of the other presentations that we have. And I'm really looking forward to being able to get people to rethink the way we can shape healthcare, because there are no simple solutions. But the notion that we should have a system in which we are at risk, a system we call value, in which we're encouraged to keep people well, is something that I'm really looking forward to talking about.
Well, thank you, Dr. Davis.
Thank you.
And thank you for joining us here in Aspen, Colorado. And don't forget to follow us on social media at Mount Sinai NYC.